Okay, good afternoon, everybody. Thanks for joining us on what is our last Capital Chat of 2025. That's actually kind of hard to believe. I'm Brooke Lovelace, for those that don't know me, and I'm the Executive Director of the Iowa Developmental Disabilities Council, and I'm glad that you're all here with us today. Also glad that we have some legislators here with us today joining us on our last Capital Chat. Just some housekeeping things for you. Please stay on mute unless you have a question, and you can come off mute for that or raise your hand. We do have an interpreter for you that hopefully is pinned in your screen. And then we also have a closed captioning at the bottom that you can click on by just hitting that show captions. I believe that's all the housekeeping. We will have time, I think, for questions at the very end. And with that, again, welcome. And I think I'm turning it over to Amy to introduce our guest speakers.
Yeah. Well, thanks, Brooke. Thanks everybody for joining us on a chilly day. We had like 83 registrants, so I'm assuming we'll keep getting more coming in. But I did want to let people know that we do have Representative Turek joining us a little bit later. So a lot of you joined to hear an update on Let Us Work campaign and the Work Without Worry update. So that will happen at 12:30. He'll be joining us. But this morning, right up front, we wanted to, I think in the last Capital Chat, we talked about how we have some new leaders on the Health and Human Services Committee. That's what we shortened to HHS. And we wanted to give you guys a chance to meet them and, see their faces, learn a little bit about them before the legislative session starts. So we were really fortunate to have Representative Austin Harris. Oh, sorry, my dog's going crazy in the background. Representative Harris join us right now. He is the new chair of the House Policy Committee, the House Health and Human Services Committee. So they do the bills that are adopted. It is not the budget committee, but they do the policy issues that pass through. And we are having him join for a little bit. Each of the legislators has only a few minutes or 15 minutes with us, 10 minutes with us. So we just figured we'd have them talk. And then if you have follow-up questions, Carlin and I will touch base with them once session starts next month and help get you those answers to that. So just jot down your questions for later. And when we have our open discussion, we can kind of take note of some of those. But I want to welcome Representative Harris here. Senator Warme will join us if she can. She's kind of in between getting her license renewed and going to her child's school, so elementary school. So we will have her jump in when she is able to. But welcome, Representative Harris. I just wanted to make a few notes about Representative Harris. He, oops, advance my screen there. You can see his district here. He represents Appanoose, Davis, Monroe, and Wapello counties. So if you're familiar with like Lake Rathbun, that's in his district. Albia, it's down south of Des Moines here, kind of outside and around Ottumwa. And he also is on the Commerce Committee, which deals with insurance issues, natural resources, and state government. So welcome, Representative Harris. I wanted to just start off with a little bit have you tell us a little bit about yourself and your background. And people always want to know why people decide to run for office. So if you want to throw that in as
Yeah,
well.
yeah, absolutely. Sometimes I wonder why I decided to run for office too. Well, thank you guys very much for having me. I'm Austin Harris, state representative for District 26 here in Southern Iowa. So I've been kind of involved in politics for a while. Worked at the Republican Party of Iowa, was deputy chief of staff to Congresswoman Marionette Miller Meeks, and worked at the USDA in the Trump administration in the first term. Decided to run for office in 2022 when we had an open seat after redistricting, and had a competitive primary, but won that. But now serving my second term in the Iowa House. And as Amy mentioned, I recently became chair of the House Health and Human Services Committee. Previously, I was chairman of the Education Appropriations Committee. So this is a big turn. So born and raised on my family farm in Moulton. It's where I'm at today right now, actually. So Southern Iowa is in my blood. I think you're muted, Amy.
Sorry about that. We kind of have a mixed group here. So some people don't really know what a chair does. Can you explain, does that mean you do all of the issues, you take on everything, or how do you run a committee at the Capitol?
Yeah, that's a great question. So I'm learning it's very different between the appropriations committees and the policy committees. Obviously, when you're chairman of the appropriations committee, you are kind of the sole person to kind of decide how you want that budget to look. And now transitioning into a policy chair, committee chair, it's a lot different. You have a lot of colleagues who have different ideas, different bills that they want to see move out of the committee. You have to sort through what's important, what's necessary, what works. So, as the chairman of the committee for the last month or so, after we finally got done with harvest, I've been getting into the groove of things and have met with several of you folks and different other organizations and constituents who have issues that are going to be important to that committee, relevant to that committee, and trying to figure out what our priorities are going to be. Typically, the House Health and Human Services Committee has been known to push out a lot of pieces of legislation of the committee. Not all of that gets a vote on the floor, nor does it get over to the Senate and down to the governor's desk. And something that I've told our staff this year is let's really kind of focus on what we want to do. So I think this past year there was over 60 bills that got out of the committee. That is not going to be anywhere near what we do this coming year, hopefully. I told the staff 20 max. And so, we are going to, I think, prioritize some of the things that are really important and crucial that have a real chance of getting across the finish line this coming year.
Well, I have like 20 bills for you anyway, but
Yeah.
no, we appreciate understanding that. I think a lot of people don't realize that you kind of organize it all, and then you have all these subcommittees that meet and look at the bill and really see if it rises to the level of getting a committee vote. So you mentioned the big issues and trying to narrow the focus this year. Do you have any ideas of what big issues might be coming through your committee this year?
Yeah, we're still trying to refine what exactly we're going to be doing. I think we'll have an overall welfare reform bill. One of the other things I failed to mention was that anything that might be a related subject, we're going to try to, combine as much legislation as we possibly can, as long as it works. But I think overall welfare reform bill will be coming. There will be some ideas that we're kicking around of how we can help bolster the governor's rural health transformation plan proposal that hopefully will get approved by the feds and receive money for this by the end of this month. How can we help support that and expand that as well through the state? And then something obviously that is very important to your guys' organization is work without worry. So that talking with Representative Turek and working with him, that is going to be a major priority for us this year, at least on the House side. I think it makes sense, and we're going to try to get it done.
Well, I know there's some excited people to hear that on the call, because there's a lot of folks that have really really worked hard on that, and we really appreciate you taking a serious look at it as well. If you were king of the world, and maybe you actually probably are, if there's one thing that you could make sure got done this year and to the governor's desk, what would that be?
Well, pay increase bill would be nice, but that's not going to be relevant to the HHS committee. But all joking aside, I honestly, and I'm not trying to pander to this group or anything at all. I really wish, if I were king of the world, that we would get work without worry done. To me, it's just common sense. People who want to work more should be able to do so. We obviously, I've met with some folks who, own their own business, who aren't able to work as much because they're going to be kicked off Medicaid for it. And so to me, it's just common sense. I want to get it done. It's a major priority for me this year. It's probably my top priority, and look forward to working with Representative Turek and others to try to get it done this year.
That's fantastic. And I know just for everybody on the call, he has said that in multiple meetings. So it is not just being said for you guys. I know Carlin has met with him already, and Zach and some other advocates have worked there. Well, this is all really great information. One thing, I do have your email on here, and I was just going to tell people that it's probably easiest since this job as HHS chair is really could be a full-time job. A lot of people don't realize legislators are part-time. Even though it's not part-time work, it's full-time work, but they are paid part-time and have other jobs that they have to go back to. And HHS, you do take on a lot. You spend a lot of time outside the legislative session meeting with the thousands of people that have an interest in the HHS committee. But so that's why I mentioned if you have questions, keep them so that Carlin and I can kind of aggregate that and help get that information to him rather than everybody individually sending, because I can imagine you get thousands and thousands of emails a day, and you try to get to your constituents first. And is there suggestions you have for people if they want to advocate? Should they talk to their own legislator first and then ask them to connect with you? Or how do you advise people to advocate?
Absolutely. Yeah, I was going to mention that. So thank you for bringing that up, Amy. I appreciate being here and talking with you all and meeting with everybody that I possibly can. But I'm just one of 100 in that building, or at least in the House side. So it's important for everybody on this call to reach out to their senator, reach out to their representative, talk to them about it, especially when it comes to the Work Without Worry bill, and share a personal story. I mean, facts and figures are important and help guide us, but really, I think what motivates legislators, what motivates politicians are personal stories that they hear specifically from their constituents. So engage with them, talk to them. Don't wait till the last minute to do it. Start right now. And so I think that will go a long way in helping push that piece of legislation through.
Excellent. Well, thank you, Representative Harris. I know you've got a busy meeting schedule and you got a nice snowy blanket out there. I'm sure if you got to get anywhere, it's going to take a while. So we really appreciate your coming on. And I think Senator Warme said she'll call in about 10 minutes. So we might just start moving forward with our agenda. But thank you so much for joining us. I appreciate it.
Yes, thank you.
Bye-bye.
Thank you, Representative.
Well, I'm going to turn it over to Carlin. We're going to skip over to Representative Turek. Is he on yet, or?
He is on.
I'm here.
All right. Well, thanks for joining. I'm going to turn it over to Carlin then.
Well, great. I get to introduce a representative who has become a friend. Representative Turek and I knew each other from a previous organization, and when he got elected to the House of Representatives, I couldn't have been more thrilled because I knew what a difference he could make. And so it is my pleasure to introduce him today so that he can talk about some legislation that he's been working on for the last 2-3 sessions ever since he started. And it's great to hear Representative Harris showing his support for it, because I know that's something that Representative Turek has been looking for is some support and common ground. So glad to have you here today, Representative Turek, and we'd love to hear what you're working on, especially with Work Without Worry.
Yeah, it's great to be here with you all. I'm actually here at the Capitol, here at my desk. Seems very appropriate for a Capitol chat. I'm incredibly grateful to hear what Representative Harris said. I will say this. The goal up here as legislators ultimately is that we provide bipartisan solutions to people's problems. And Representative Harris has been a good friend of mine, and we have worked together in a bipartisan manner on some other bills. And so I'm genuinely excited to work with him on Work Without Worry. We were actually up here at the Capitol together, working with the department staff and the legislative liaisons, going through some of the fiscal components and elements of this. And as he stated, I come into this session with an enormous amount of hope that we can actually get this finally to a full House vote and get it over to the Senate and ultimately get it to the governor's desk. I think most of you are at least somewhat familiar with me, but for those that aren't, I'm Representative Josh Turek. I represent Council Bluffs and Carter Lake in the Iowa legislature. Very proud to be the first permanently disabled member of the Iowa legislature. And unfortunately, the Iowa Capitol wasn't even fully accessible. Now we've got a ramp here in the Capitol. I'm looking at it right here. It's the People's House. It should certainly be open and available to everyone, regardless of disability or not. And really, I have been a champion to represent the 1 in 5 individuals with disabilities in this state, whether it's the blind, the deaf, the intellectually disabled, or the physically disabled, and to try to fight for removing barriers to healthcare and to employment. I think some of you as well know that I have decided I'm going to leave the Iowa House. I'm currently running for the United States Senate. Senator Harkin, who was the father of the American with Disabilities Act, his seat is now open and available. And so I've been working very, very hard over the last 100 days traveling the state. And it would be amazing to not only have representation for the 3.2 million Iowans, but to be able to have representation in the United States Senate for the millions and millions of Americans and also millions of disabled Americans. And so that has been a lot of my focus. However, we are about to go back into the legislative session. And as Carlin had mentioned, most of you know the real magnum opus of my legislative work has been this work without worry, or as many of us may call it this year, let us work. This is, to me, the single largest barrier to individuals with disabilities in this state are these unnecessary income and asset limit barriers for those that need to be on Medicaid for their health care. The last 2 years, we have been able to unanimously move this through HHS policy. We've been able to get it both through subcommittee and through committee. But as you heard Representative Harris say, there is commitment on both the Republican and Democratic side to be able to see this get to a full House vote. And I can say that that is certainly not just lip service. As I said, Representative Harris has already come up here to the Capitol with me. We've been working on some of the language and some of the changes to it. I also got a call yesterday from Representative Wills, who is on HHS policy, and he has said, Josh, this is 100% one of our priorities in this. We want to see this get to the finish line. What this is essentially, I think most of you are familiar with it, but it's for those of you that would be on Medicaid for your health care. Right now, we have 250% of the poverty line limit on income. It's a real big barrier. And then the other side is the asset limit, $12,000 for an individual. And it was $13,000 for those that were married. We have now been able to at least move that to be doubled to $24,000. But what we're ultimately looking at arriving at is to have no income and no asset limits on this. And it would be a situation where the more money that you make, the more money that you pay into the system for your health care. Many states have done this. This isn't just a Democratic idea. We've seen this done in blue states. We've seen this most recently done in a red state like Tennessee. It's a bipartisan idea. This will help us to actually have individuals that want to work to be able to be gainfully employed, full-time employed, to actually be able to own a home, to be able to own a vehicle. But the real benefits are the positive fiscal impacts will be able to move individuals ultimately into a situation where they're paying state tax, they're paying federal income tax, they're removing themselves from the need for SNAP benefits, for Section 8 housing, et cetera. And especially as we're seeing all these workforce issues right now, and now for the very first time, we have individuals that are able to work remotely without the need for transportation. It is just a perfect moment to get this done. As I've said, I think this is the single largest barrier to individuals with disabilities. Two other things that I do want to talk about is 14C. I'm going to sponsor a bill again this year to remove, to have Iowa ban 14C certificates, at least for-profit business. And 14C certificates allow currently a for-profit business to be able to pay someone with a disability a sub-minimum wage. I believe that there should be a dignity in work, and so I would like to remove these income and asset limits, but also not allow companies to take advantage of individuals with either a physical or intellectual disability and pay them a sub minimum wage. And then the last bill that I'll talk about, because I'm not going to sponsor a ton of bills this year, especially with me running for the U.S. Senate, is I do want to continue to work on what we're seeing with the HCBS waivers, 26,000 disabled Iowans that are on these wait lists. We need to put more appropriation towards us. I know that we are constantly talking up here about moving that system away from the 7 different waivers and moving that into an individualized waiver system, which I'm 100% in favor of. A waiver for children, a waiver for adults, and possibly a waiver for elderly. As so many of us with disabilities, we present completely different. Every one of our disabilities and our needs and our supports are completely different. I like the idea of having it individualized, but ultimately, unless we put more appropriation to address this, we're going to continue to see these wait lists continue to grow and the wait times continue to increase. Right now, the wait list for individuals with disabilities, for intellectual disabilities, for example, is nearly 7 years. That is far too long. And then what I'll say is particularly on work without worry, or as we may end up seeing this morph into let us work. We really need everybody's help on this. There's only so much I can do as one legislator, but as you can see, and you've already heard today, we have bipartisan support to be able to get this across the finish line. What I would love to see is for each and every disabled Iowan to reach out to your legislator and to contact them, both on the House and the Senate. We need to say individuals want to work. Let's remove these unnecessary barriers to working. Additionally, I would love to be able to have as many individuals, particularly with visible disabilities, up here, as Representative Harris said. Sometimes it's not even the facts, it's the personal stories. And so coming up here, we start session on January the 12th. We have Funnel Week, which is funnel is we need to get a bill through both subcommittee and through committee by that date. That's at the end of February. I would love to have individuals with disabilities up here every single day that we're in session. That's Monday through Thursday, starting from January the 12th all the way until the end of February. I will certainly assist anybody that's up here to be able to have the right conversations with individuals, both in the House and Senate, that are on HHS budget and policy. But this really is an amazing opportunity that we've got to be able to get this. As you heard, this is now bipartisanly supported. This is a priority, not only on my side, on the minority side, but also on the majority side. We can get this to a House vote. We can pass it unanimously. I really, truly do believe that. We can get it over to the Senate. We can get it signed by the governor. And I promise you that there would be no prouder moment in my entire life than to work on this policy, because I do really believe that this is the single largest barrier to individuals with disabilities. So I'm going to need everybody's help. So whatever you can do, whether that's sending an email, making a phone call, certainly if we need assistance with transportation and issues, we need to have as many individuals up here every single day advocating for this. But there's a real possibility for us to get it to the finish line. And with that, I'll stop.
Keep talking. You're doing my job here for me, Representative Turek. I know we have some questions in the chat, and we want to talk more about the Let Us Work campaign, but I think we need to let Senator Warme have her time because her time is limited. So is that right, Amy?
Yes. So Senator Warme is just was able to join us, and she's just got a few minutes because she is mentoring at a elementary school today. So we don't want to keep her from that. That's important work that she does too. As you're starting to see, our legislators have many hats and they do a lot. And so we really want to thank her for joining. She is the new chair of the Senate Health and Human Services Committee. So the same position that Representative Harris has, only in the Senate. And she is also on several other committees, including appropriations, commerce, technology. A big one that I know a lot of you talk about is transportation. And she's also on the, at least for now, the HHS budget subcommittee, which deals with the funding side of things. She represents, as you can see, and oddly enough, both Representative Harris and Senator Warme represent District 26. She's Senate District 26 and Representative Harris is House District 26. So I just noticed that today when I was putting the slides in, but welcome, Senator Warme. I just wanted to give you a chance to talk about yourself, what your background is, and tell us a little bit about yourself. And people always ask why you decided to run for office. So if you want to throw something in on that, that would be helpful too. So I'll turn it over to you.
Great. Thank you. And it sounds like you were doing important work with Representative Turek. So thanks for letting me interrupt. And I won't take too long. We'll let you get back to that discussion. But I am between things today. I don't know if you can see behind the car, the school parking lot, but I'm going to run in and do some mentoring here. So as Amy said, my name is Kara Warme, and it is funny that Representative Harris and I both have District 26. We're making the rounds together as new chairs, and that keeps coming up. So I have the center part of the state and really honored to be chairing Health and Human Services this year. So my background, a little bit about that, actually worked in the private sector for 20 years. So I have an engineering degree and a master's in business. And it was through the COVID pandemic when I made a big shift in my life, like a lot of people did. Had already been working remotely for years in Iowa, heading into that. And so by the time it ended, I really just wanted to get more engaged locally in my community. So I started substitute teaching at my daughter's schools. I have two daughters now who are 8th and 10th graders. They were younger then, and really saw the mental health needs in schools. And so that was a lot of the push for me. I started working at a large behavioral health nonprofit that serves youth and families across the state, saw the impact that public policy has. And my senator was the chair of Health and Human Services. And so I was talking to him a lot about the challenges I was seeing in schools and within the nonprofit sector. And when he decided to retire, he called me and said, hey, you could do this. And I decided to step up and run. So health is something that is really important to me. And I want to make sure that I'm listening to all the stakeholders and the voices that are out there. I know I have met a number of you at the Capitol last year already, serving on the HHS budget and just interacting as you come to visit. I appreciate that and love those opportunities. And so as we dive in this year to Health and Human Services, we'll really be thinking about workforce, knowing that we have an aging population in Iowa. We have a lot of needs for people to work at all levels of human services and healthcare. And so we want to recruit and retain the best providers in both our urban and rural areas, make sure we have access to those. So I've been having lots of conversations on administrative burdens that make it hard to do the job and keep people from time with their patients, where instead they're at a computer or on the phone or filling out a duplicative form. So as much of those kind of things we can reform in government to get out of the way and make sure that those professionals can be focused on helping Iowans, which is what they have trained many years to do. Let me pause there and see what else Amy or others wants me to mention.
Yeah, well, you kind of started in on that with workforce, which I know has been a huge issue with our the folks that are on this call, making sure that they have people that are with them that can provide those services, provide them in a professional manner. And we know that the turnover is disruptive because they do a lot of work, personal work for people, and it's tough to have that turnover. So we really are happy to hear that workforce continues to be a priority. What other things do you think are going to come up this year? If you look in your crystal ball, what kinds of things you could see, maybe not necessarily coming out of committee, but things that the committee probably will be looking at?
Yeah, so we know that cancer has been a big focus in Iowa. Unfortunately, it's an area we're leading that we don't want to lead, with some of the highest cancer rates and some increases in certain ones. And so we allocated money last year to the University of Iowa Department of Public Health to dig in and see if we could understand why. We know it won't be a silver bullet single answer, but they've isolated which are the cancers where Iowa over indexes, and they're digging into some of the things we might be able to do. So I expect to receive and react to that information and look at where it's education, where it might be a policy shift, where it might be a partnership with local public health or other nonprofits, other entities. So I know that will be a focus. Another one is the rural health transformation application that we made. The governor's office and the Department of Health and Human Services did a great job piecing together our application, which could be hundreds of millions of dollars in federal funds, into Iowa to help in rural health and really to help statewide. And so there are things we can do from a policy perspective to codify some of the things in that application, which would increase our score and help us beat out the other rural states who are applying for those funds. So really excited about that application. And there's a number of pieces in that I expect to see hitting us from a policy perspective.
Thanks. Yeah, we probably need to plan on talking a little bit about that in our capital chats in January, because we haven't really touched on that, and it really does help bring more stability to rural health services, which anybody out in rural Iowa, disability or not, is really important for their family.
Right.
And important for economic development, right? So, because businesses want to make sure that that's available. Well, we really appreciate your time. I know you have planned on being at your daughter's or your elementary school at 12:30, so we don't want to interrupt that, but we really appreciate that. And what we have told folks is if they have follow-up questions for you, they will get them to Carlin and I, and we will touch base with you when session starts, so you're not getting 8,000 emails from everybody, because we know you're wearing many hats. And so we'll plan on touching base if there's anything follow-up. But thanks for joining us. We really appreciate you being able to work us in today.
Absolutely. Thanks for having me, and everybody have a wonderful day and happy holidays, and look forward to seeing you at the Capitol.
Thank you very much. Well, Carlin, I'm going to turn it back to you. If there's any questions for Representative Turek, or just let me know if you want to go on to the next slide about the Blitz.
Well, we can probably tie those two things together. I appreciate Evan putting a question in the chat that says, what can an individual do to assist moving work without worry forward? And that's perfect, because that's what we were going to talk about. And I'll let Representative Turek or Representative Harris maybe answer that first because they're the experts in moving things forward, before I give my opinion here. So you want to chime in?
Is Representative Harris still on this thing?
He is, but I think he also told people what they can do to get up to the Capitol, share your stories, make sure that your own legislators know your story and how important that is. And we started doing that a little last year, which I think is why we're in a position we are now, because Representative Harris heard your stories, and his colleagues, and now Representative Wills, who's in the Ottumwa area, has heard those and is wanting to be a part of it. So it's like social media campaigns when you hear about people going viral. All of you advocates on here that have shared your stories, that's what you've helped do, is get this going viral. I think when you look at what Representative Harris said and what Representative Turek said, they're 2 people out of 150 at the Capitol, out of 100 in the House, but out of 150 total at the Capitol. And they can only do so much, and use their influence to do so much. So it really depends on everybody pitching in to help get this over the threshold of having at least 51 votes for something in the House. And that's a big challenge. But that's my opinion, so feel free to add to that.
I'll just chime in and say that when Amy says everybody can make a difference, that's true, and that's the key. One of the things that we're emphasizing with the Let Us Work campaign. So the idea of the Let Us Work campaign is that, the Work Without Worry bill and policy change would make a difference, definitely, for people with disabilities who are employed or want to be employed in Iowa. It's one very positive change that could help move things forward. But it's just one thing. We could be doing a lot more. And so we want to talk more about other opportunities and possibilities that will move more people along and reducing barriers. But the thing that's so important about this topic in this campaign is that it's not really just about employment. This is about how Iowans with disabilities are perceived and treated in Iowa. We're in across the country in some respects. We're treating them differently because they're using Medicaid for health insurance or because they have to be on public assistance. So that means we're limiting how much or how many hours or how much they can earn in wages. And there's no other population in the United States that this is happening to. We don't take away people's health insurance because they want to work. It's usually the other way, or the other way around. So you lose your job, you lose your health insurance, and nobody wants that either. So that's why this, talking about this particular issue and what could change if this was passed, it's changing the perception of how people with disabilities are treated, and with, as Representative Turek said, with more dignity, and as Representative Harris said, this could be a major game changer for other parts of our system that rely on help for people with disabilities, other parts of our public assistance system. So it can be a major game changer in many ways than just what this particular bill is emphasizing. So that's why we're putting this under a campaign. And as both of them also said, telling your personal story is what's really important. And I want to emphasize too that we are um, uh, encouraging everybody to reach out to their legislators, and that's email, asking for meetings. And so if you all are getting more email as legislators, that's our fault. But we want you to tell your personal story so they understand that this is coming from people like you, and how the impact is going to be felt for individuals, not just for our organizations and the work that we're trying to do to help. So make it personal. It's about you, and it's about the impact that it can have on you and the state, and how we again treat and support people with disabilities. And this is a support mechanism that can make a huge difference in the amount of support that could be given for this particular issue of employment. So the campaign is to reach out and talk to your legislators this fall, or it's not fall anymore, it's winter. We encourage everybody to reach out before the session starts, and that's why some of you have probably already gotten some email or some calls. And some of you have copied me on the letters that you've gotten back from your legislators, and thank you for that. That's helping us understand what they're thinking, and we're seeing a lot of support, which is awesome. And then during the legislative session, which is January through um, early May, is to come to the Capitol if you can, and we're willing to help you do that. And if not, again, just keep in touch with your legislator during the campaign, and let them know how you feel about things and where things are moving, and offer yourself as a resource for helping them move this along, because they're going to be the heroes that move this along, and we want to be able to hold them up as heroes. Is there any more questions about the campaign? The campaign is basically you sign up online, and once we have your information and that you want to work on things, we'll send you some talking points and things that you can do to help contact your legislators easily.
Just want to add in quick, Carlin. Half of the battle to be able to get legislation across the finish line is just education and awareness. And so it really, really is imperative for those of us with disabilities in Iowa to do what we can to make sure every single legislator is aware of this issue. When I first came up here 3 years ago, no one knew what these income and asset limits were for Medicaid, that this was preventing people from actually living being gainfully employed. So everyone reaching out, it really does make a huge difference. I will also give you some tips when you are emailing or when you're calling. You need to make sure that you've got your name on there, your address, so that they can see that you're actually from Iowa. I would say put your phone number on there. And again, it's the facts, but it's also the personal stories. Here's how it is impeding me. This is what it's preventing me from doing, from getting married, being gainfully employed, whatever your situation is, make sure that it's in there. And I would also say less is more. The shorter, the better. If it's pages and pages, we as legislators, we get hundreds, if not close to 1,000 once we get to this part of the year. And so just make sure it's as concise as can be. And like I said, once we get to January, for those of you that can actually physically be up here, those of you particularly with visible disabilities, that is going to be invaluable in this process of getting up here and actually making our presence felt every single day and talking to as many legislators face to face about it. Legislators, we can ignore a lot of emails, but it's very different when you've got somebody right here in the Capitol to talk to you face to face. You can't ignore that. But if we work together, we can get this thing across the finish line.
Exactly. That's a great way to kick this off and send this off. We got to be working together on this. So thank you for joining us, Representative Turek. I really appreciate your insights and those tips and insider information to help us all again work together to move this along. So, and thanks for all your work. All right, I know Amy has a few more slides that we're going to, let's talk about budget too.
Well, some of this is a repeat, right? So I just lost my notes. A couple quick things. The House and the Senate are both, Republicans are both caucusing next week, and I think the Democrats plan to caucus also in the coming weeks, and that means they're kind of getting together and kind of mapping out their plan. One of the things that we've been talking about is that there will be some changes in committee memberships on the Senate side. So watch for your emails or on social media. We will post what those changes are. We've heard that there might be some big changes in the Senate HHS committee. We heard that from the new leader a few weeks ago. And so we'll be watching that. For those that you might live in House District 7, that's up in like the Rockwell City area, so north of Fort Dodge kind of area. They have a special election. Representative Sexton, who had represented that area, was tapped to be the new rural health or rural development director in the Trump administration. So he resigned, and so there are two women running in that area, and that special election is December 9th, so next Tuesday. You might want to get out and vote. You could probably vote, you can vote at the your county auditor's office on Saturday. They'll be open, as well as Monday. If you wanted to vote early, if you were worried about getting out in the snow or getting transportation, you can do that early. And we will have a new state representative to announce next week. And then and I would say one individual is a small business owner and the other is a speech language pathologist. So we're looking forward to seeing who this new person will be. And then on December 30th, right before the new year, there is a special election for Senator Claire Celsey's seat over in the western side of Polk County. She's got a little sliver of Dallas County. That's kind of the Windsor Heights, West Des Moines area. And there are two individuals running in that seat as well. So we will have a new Senate district senator at that point in time. Also, same things, you can vote early at your county, at the election office, which if people live in Polk County and don't know this, our county election office has moved. So make sure you go to the right place. It's not in the downtown area anymore, so it'll be a little more accessible than it was before. So we will have some new legislators, and then we'll find out what positions they'll hold in their caucus in terms of what committees coming up here soon. And I will update the legislative guide. I keep updating it. I still have not checked to see if this is the most special elections we've ever had in a year. It's definitely has in my 30+ years at the Capitol, the most special elections in one year, unfortunately. So then I just wanted to update on a couple of the big issues we've been hearing about in our meetings. Budgets are going to be tough this year. We have a $252 million Medicaid shortfall and a 9% drop in revenues, which were anticipated when legislators decided to go to a flat income tax. We're now at that level, so hopefully those revenues start to turn around, challenging with the farm economy. So I think you're going to see legislators trying to do as much as they can to kind of stabilize the budget. That hopefully won't mean cuts, but it will definitely mean looking at some of the things that the DOGE report highlighted, which is like things like sharing services, doing more with kind of spreading those dollars out further. And we will talk more about what's actually in that DOGE report. DOGE stands for Department of Government Efficiency. It was a committee that the governor put together to kind of look at ways we can do better at governing. So there was a lot of things in there about local governments and shared services. Like, does every community need a police force? Can they work on a more regional level to maybe partner with the sheriffs or multiple cities sharing like a police chief or a fire chief, and what things can happen? We're starting to hear more about sin taxes, looking at increases in tobacco and alcohol taxes, carbon pipeline. For those that were watching last year, that was a very divisive issue on using the eminent domain, which basically means the carbon pipeline people can purchase your land and you don't have a lot to say about it. That is still going to be a key issue because the governor vetoed that bill. So it's still a live issue at the Capitol. Next week, we have the Revenue Estimating Conference, which is the group of 3 economists that get together and they kind of look at how much money's coming in through taxes and everything, and how much money's going out in our spending, and kind of seeing where we're at. So that 9% drop in revenues could be more, or it could be less. But by law, the governor has to use the estimates that this group comes up with to build her budget, which she'll announce on the Tuesday after session begins. So that's the 13th, I think. It's that week, whatever that date of that Tuesday is. So she'll announce that her budget then, and we'll kind of know where she's directing spending, but we know a lot of it will be around rural health, and cancer is really coming up, as Senator Warme mentioned, to address those issues. I also want to remind people that there was a bill that would have required Medicaid to allow options for catheter tubing and stuff that are a lot of times Medicaid will only pay for ones that have cancer causing components to that. And so there might be an opportunity to talk about things like that too, to make sure that you're not giving people who use that equipment a higher incidence of cancer. And so those are kind of some of the things we've been hearing, and you heard from legislators some of their stuff. I probably need to add work without worry to my list. It sounds like that's good news. And that's my report. I will mention that We have one other state representative who's new on the HHS committees, Representative Austin Baith. He's a physician and is seeing patients today. He is now the new ranking member on the HHS budget subcommittee. That position was held by Representative Turek, but given that he has another office he's running for, that position was moved over to Representative Austin Baith, who is from the Des Moines area. So he will join us in January to kind of do the same thing that Representative Harris and Senator Warme did today and introduce themselves. So we will make sure we schedule that when we move to our half-hour capital chat. So just a couple of things. You'll see Governor will announce her priorities and budget on January 13th. We're back in session January 12th. Legislators have a short deadline this year to request bills. So if there's new bills that they want to have their name on, they have to request those. They don't have to have them filed by then, but they have to request them by January 23rd. So that's just 2 weeks into session. They have to already have those requested. And then it's just a month later that you have that first deadline where a bill has to get out of its first committee. So, for instance, if there's a new work without worry bill, that will need to come out of committee by that February 20th date. Our schedule is going to change. We're going back to our every other Friday chats for a half an hour. So there'll be quick updates on things going on, and we'll have our written reports going out. We'll continue to do our bills of the week, which I hope everybody found useful last year. We had a bill of the week that went out to advocates and legislators to kind of give them some information about bills that you're tracking and highlighting and thinking are good policy. And then they have a one-pager talking points, advocate talking points that you can use to help advocate on those bills. And so those are on our website still from last year. And if you want to take a look at them, a lot of those bills didn't pass. So about half did, but a lot of those bills didn't pass. The work without worry ones up there still. And then those are our dates for our capital chat schedule. So I will stop. Got 7 minutes left to, if there's any questions, comments, or thoughts.
Yeah, I got one. You hear me?
Yep, go for it, Robert.
Okay, Amy, thank you for your time. I've been trying to talk to the governor. I've been trying to call the office. I've been trying to talk to Nick, leave a voicemail in the office, trying to get a hold of Nick. Somebody told me to get a hold of Nick because he is the head of the, I don't know what, he's the head of Deputy for Governor Ronald. So anyway, I tried to get a hold of him and nobody answered. Earlier, when we got on here, earlier I've been trying to get a hold of the office and nobody answered. I leave a message, nobody answered. I leave a message, nobody answered. So I don't know what the deal. So me and my mom is going to go to. Me and my mom is going to go to the February Iowa Capitol in February to talk about the ACH bill. It is long overdue because I know it's long overdue because I've been trying to deal with this for years and years and years. And I know I know what you don't have to say to me. You have to wait. But I know, okay. And okay, I'm done. So you can do.
Thanks, Robert.
Yeah.
I know that if you left a message with the governor's office, it for sure went to her staff to make note of that. They may not have the answer or have something for you right away, but I know I know that
Amy.
they make note of those and like try to follow up afterwards.
Yeah.
So that
Yeah.
might be
Yeah.
the reason. If you
Oh,
didn't hear anything, or if you were just leaving a comment, they definitely got that information.
Amy, I want to stop you right there because I believe me, I talked to that governor bravely. I talked to that governor bravely on that governor day, in her own words, she told me that she is going to talk to me on Zoom. That are her own words. That was about, I don't know what year, about we were at the way station in a jail, having the semi, wait on the semi, and I talked to the governor, and the governor looked at my mission, my awareness, and everything, and and that's why I've been trying to get a hold of them, and nobody answer. And and I went, and now I feel like they are taking my calls, and and believe me, I've been trying to call that lady. I don't know her name. And I talked to that lady, and the lady told me that we will get the message to somebody. And okay, so somebody would that was a couple of days ago, and somebody now returning my phone call. And I hate that when somebody now return my phone call, because it made me feel like they 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 don't want to deal with me or something.
Well, we appreciate how persistent you are, Robert.
Yeah, but are you did what did you take a fine for me about that governor, about not about keep calling that governor on ask them about what is the deal with that?
I think we can talk to Carla, and I will talk and see what we can do and Brooke can do. I know Brooke has regular meetings with HHS, and so let's see what we can do. We'll get
Okay,
back to you.
okay.
Thank you, everyone. I know we're at a minute now, so I'll give you 30 seconds of your day back. And this is recorded, so if anyone you know didn't get to be on it, it'll be up on our website here next week, and you can watch it. And have a great holiday.
Yeah. Happy holidays, everyone. Be safe out there.
Thanks, everybody.